Hello and welcome everybody to KidsX Demo Day. My name is Yael Kessler and I'm the Associate Director of Care Model Innovation and Emerging Technologies Research at CHLA. And I'm also a part of the leadership team at KidsX. Thank you all so much for joining us. We're really excited to be here, and to MC Demo Day, I'd like to call up Omkar Kulkarni, Chief Digital and Transformation Officer at CHLA. So without any further ado.
Thank you, Yael. All right, good afternoon, everybody. Thank you all for being here. So, KidsX is really special, largely because we are exclusively focused on pediatric digital health, which is an underappreciated and underinvested, and honestly, a very important part of digital health, and one that's incredibly important for us as we are here as a health ecosystem. And so I'm glad that you're here today to join us. KidsX is a consortium. We are anchored by a consortium of over 30 children's hospitals from across the country, actually across the world, who come together to specifically focus on improving digital health innovation. We have some of our hospital members out in the audience today. And so what we've done is we built this ecosystem of entrepreneurs, payors, investors, corporate partners, and of course our partner health systems to come together to drive pediatric innovation. Our consortium, we'll go to the next slide, is made up of leading healthcare organizations from around the world. As you can see, the logos on the screen, so we got 30 children's hospitals from across the world. It is based in Los Angeles at Children's Hospital Los Angeles, which is where I work. But we have health systems from Israel, from Canada, from Spain, as well as all across the United States. And so we're really proud of our network and really appreciative of our network of children's hospitals. Each year we align. What's special about KidsX is we're focused on the problem. We're focused on identifying problems first and then identifying solutions second. So what we do is we work with our children's hospital partners, the ones on the screen, and we identify what the most pressing problems are in pediatrics every single year. And then we go and find startups that are specifically designed to solve those problems. Next slide. We started in 2020, and since our inception, the KidsX Accelerator program, we'll go to the next slide. Oh, it is the next, there we go. The KidsX Accelerator has provided digital health startups with tons of support, both during the accelerator and beyond. We are specifically looking for ways to give startups an opportunity to validate their products in the market, which for the startups in the room, you know how difficult that is to find that first partner who's going to help you validate your product. And so that's one of the things that KidsX can do. This year we have a cohort of 8 amazing startups. This is our 3rd cohort that we've run of our flagship program. We have 8 amazing startups that you will get a chance to meet with, to hear from many of them. These leading digital health companies have already begun to facilitate long-term partnerships with pediatric institutions from across the country in anticipation of this world that is continuing to evolve. I think we all know that pediatric digital health is a space that is incredibly important as there are more and more health problems that are being identified by related to kids, specifically in mental health, behavioral health, but also all sorts of developmental healthcare topics related to pediatrics as well. You can see our 5 programs on the slide behind you. We started 3 years ago, and many of our alumni have successfully secured pediatric partners. They've closed fundraising rounds, they've won awards, and celebrated many other milestones we want to highlight along with this year's cohort. So we'll start with Artera. I believe there's some folks from Artera in the room. Ooh, there we go. Is that better? So Artera is from our first cohort, our 2021 cohort, and they were named recently on the Inc. magazine's 5,000 list for the fastest growing private companies in the United States for the 4th year in a row with their integrated patient communication solution. So they've got a booth here today. They're doing incredibly well. We actually use them at Children's Hospital Los Angeles. There's a handful of children's hospitals from within the KidsX network that are using the Artera solution. And so not only have they been awarded many different prizes, but they're also being used by many children's hospitals in KidsX consortium. Next slide. Limbix. Limbix is from that same cohort. They were recently acquired by Big Health as part of their expansion into adolescent mental health. So Limbix is a prescription digital therapeutic platform that provides mental health treatment for teenagers and adolescents, and they've gone through FDA, they've gone through various validations, and their product's amazing, and they were recently acquired. So we're very proud of the Limbix team. Next slide. Rayos, who I believe they've also got some folks here, they're from our 2022 cohort, and they've successfully raised over $10.5 million in Series A funding to support launching their novel hydrocephalus shunt monitor. It's an amazing team focused specifically on this patient population that's been neglected over time, and they've got an amazing tool, amazing product that they're excited to bring to market. So very excited about Rayos and all the work they've done. So during our annual problem identification day, which is one of my favorite sessions that we do, we bring our KidsX hospital, those 30 hospitals together to discuss their strategic priorities, the largest gaps in pediatric care and where they're actively looking to adopt innovative solutions. So that's our process around how we do it. You can see it on the screen. This year, some of the common themes that came up were about improving care coordination, supporting mental and behavioral health, the crisis that exists, and based on these insightful conversations, we selected a group of startups that solved specifically for these areas. You're going to hear about them in a minute, but they're all rooted in problems that our children's hospitals told us were problems that they were facing. So that's the real focus around KidsX. So today we are incredibly proud to present to you our 2023 cohort. These companies, which you see on the screen behind me, are developing cutting-edge technologies in mental and behavioral health, staffing shortages in education, care coordination, patient experience, and health equity. It's an amazing group of entrepreneurs and passionate technologists and innovators who are really focused on pediatric digital health. It's such a treat for us to be able to present them to you. As you listen to the presentations, I ask people who listen to demo days all the time to, do one thing. Think about how you can help them. Think about what you can do to help these entrepreneurs, whether it's a connection you have to an investor, somebody you know at a health system or a doctor's office, something where you can connect or help them with something. Maybe you have some feedback for them on their pitch. Whatever you can do to help them, think about how you can help them. And if you can do that for us, that would make this demo day incredibly successful, even more so than we know it'll be. So I would like to introduce Bianca Riello, our programs lead for KidsX, who's been so instrumental in this cohort. She's going to be our MC for the next portion of the evening, or the afternoon. So Bianca.
Thank you, Omkar, and thank you all for joining us today. My name is Bianca Riel, and I'm the programs lead for KidsX. I've had the incredible honor to lead this accelerator program this year and work with these amazing companies throughout the duration of this year. The first focus area I would like to introduce is health equity, and as Omkar mentioned, this is a very intentional focus area for the accelerator. And really, we're seeking solutions that address bias within data, access for underserved individuals or communities, and lastly, resources for pediatric patients, families, and staff. And so without further ado, I'll introduce our first company. I'll introduce Arna Ionescu-Stahl, CEO of Wavely Diagnostics.
Hi, everyone. It's great to be here. I'm Arna Ionescu-Stahl, the CEO at Wavely, and I'm really excited to share what we're up to and also the impact that the KidsX program has had for our company. So we are solving the problem of it being really hard to do telehealth visits for kids. Kids have a really hard time expressing their symptoms, and so what that means is that pediatrics is highly reliant on schlepping into the doctor and doing physical exams, doing diagnostics, and that's a big health equity, health access issue. There are a lot of people that really want to be able to open up virtual care pathways in pediatrics, and that's what we help with. So what we're doing at Wavely is building a platform of smartphone-based diagnostics that using just the smartphone, just software, give you the key physical exam findings for the main reasons kids go to the doctor. And with that, with our physical exam finding, plus a telehealth visit, you can basically treat and diagnose a lot of the key acute reasons kids go to the doctor. So we have a platform that will eventually enable 69% of acute pediatric visits to happen virtually, but where we're starting is with the main driver of pediatric visits, and that's ear infections. Almost every kid will have one before the age of 3, 85%, and it accounts for 30 million visits a year. And today, basically all of these 30 million visits have to happen in person in the clinic. And that's because you can't get the key physical exam finding, which is middle ear fluid. So our first app implements a technique called acoustic reflectometry. Basically, basically, you play some acoustic chirps into the ear canal. And Bianca is nice and healthy. She does not have middle ear fluid, and that's it. So with that finding, a doctor can then diagnose an ear infection and treat it based on other clinical factors. And so our two innovations are, number one, implementing this technique on a standard smartphone, and number two, implementing machine learning for this technique, which hasn't been done before, and that results in two characteristics. Because it's on your phone when you need it, because the only attachment is a piece of paper, a funnel that's taped to the bottom that can be handed out broadly, can even be made at home eventually. That means it's highly accessible. It's there when you need it. You don't have to prepay, you don't have to premeditate. And then the second thing, the machine learning classifiers give us accuracy. So we have much more accuracy, a higher sensitivity and specificity than the legacy acoustic reflectometry devices. So we are actually quite unique then in the market. So on the left, you have the standard way that doctors typically look into the middle ear, and that's with an otoscope, just looking into the outer ear to guess what's happening behind the eardrum. And there's a lot of at-home digital otoscopes, which is great because it shows that there's a market and parents really want a way to understand what's happening with their kids' ears at home, but it's also very challenging. There's a lot of evidence, we're hearing it anecdotally, there is published papers about this, that it's really hard for untrained lay parents to get a clinically useful picture of the tympanic membrane. On the right, you have companies using acoustical techniques to understand the middle ear, but we're the only ones building software, we're the only ones focused on the home setting and on using the commodity hardware that people already have in their pockets. So this opens a really unique go-to-market opportunity for us, which is the digital front door. So with traditionally ear infection, you go straight to the clinic. With Wavely, we can triage and even treat a significant percentage of visits without a clinic, a significant percentage of ear infections without a clinic visit. And there's a lot of people who care. So right now we have actually launched just a few weeks ago, which is super exciting. Our first customers, and these are all representative icons to give you a sense of who we are aiming to work with. So pediatric telehealth platforms, direct primary care, are really eager to adopt what we're doing. We are also working with systems, largely as coming out of the KidsX program, which is great, and our North Star is Medicaid, and really ensuring that everybody has access to this technology, given that 56% of kids are covered by Medicaid. As I said at the beginning, ear infections is just the start. We think that if we can cover ears, lungs, skin, and throat, then we can account for 69% of acute visits. After that, we would start looking into diagnostics for chronic conditions, which have a different business model. So just a quick overcap on KidsX, which was a great program for us. We had interest from 9 member organizations, and 7 were a strong strategic fit. Of those, we are actively engaged with 4 of them, either in planning, active lawyering with contracting, or actually in a pilot with Geisinger, which is exciting. 3 others are actually on deck to now re-engage with us now that the fiscal year has turned over. So it's really an incredible opportunity for an early stage healthcare, for an early stage company and early startup to really have access to this caliber of organization and really start to be used in care pathways and collaborate with them to really understand how we can integrate our technology into everyday care. So it's been a great program for us. We have an amazing team. We have a full-time chief medical officer who's a board-certified pediatrician. It's great to have him on board. We are using a fractional executive model beyond that, and we have a great team of board and advisors. I suspect you might recognize some of those names. So our call to action, we do have a second close on our seed round coming up, so we are interested in any investors who would want to support Wavely, and any providers who are interested in using more virtual care, using Wavely's platform to enable more virtual care for kids, please reach out to us as well. And with that, thank you very much.
Our next focus area today is mental and behavioral health. We are seeking solutions that provide resources for pediatric patients and tools for providers in screening, detection, at-home monitoring, triaging, automation, and AI. Without further ado, I'll introduce Kenzie Butera-Davis, CEO and founder of Morrow.
Hi, everyone. My name is Kenzie Butera Davis. I am the CEO and founder of Maro, where we are focused on early intervention and risk detection for youth mental health. 50% of all mental illness begins before the age of 14, yet there's an average 11-year gap between the first time a child shows a symptom that they're struggling with their mental health to the first time that child receives any form of treatment or intervention. Now, there have been so many incredible solutions that have emerged over the past decade to address the youth mental health crisis. But most of those solutions have really set on this far end of the spectrum, the point of care. So where Maro sits is more on the preventative, the proactive side of the problem. We're screening kids really early, all with the mission of eliminating the 11-year gap between first symptom and first intervention. A bit about our approach, we've built a whole community model, meaning we are engaging families, schools, and providers in one integrated platform that's aimed at early identification and supporting intervention. Our platform serves three core functions. So number one, we're a data thoroughfare, which means that we're sourcing data from multiple contexts across the community and across the clinic to create one source of truth. We're also making it really easy for all of these stakeholders across home, school, and clinic to communicate transparently and easily. And we do that by collecting digital consents and engaging the family along the way. And then we streamline care coordination. So when we find a kid who needs extra support, we're making sure it's very easy for them to get referred to the appropriate service provider, either virtually or in person. More specifically, we start with K-12 schools. So we've built a platform that's a lot like TurboTax for mental health screening. We make it very easy for schools to facilitate compliant, universal mental health screening at scale. We're currently screening for anxiety and depression, and when we go into a school setting or a district, we could screen thousands, hundreds to thousands of kids in one day. And when our schools identify a child who needs treatment, we help them easily refer that child to virtual or local providers. So we're triaging that referral process. We're making it easy for families to be engaged along the way, and we're really reducing friction by collecting digital consents, by educating families, and by giving families tools to be a part of that care journey, such as tracking moods and behaviors and appetite and sleep. And that's really our secret sauce. By engaging schools and families simultaneously, we're not just scaling one school or one district at a time, but rather we're scaling by community. So the final step of closing that feedback loop, and something that KidsX has been instrumental in supporting, is the vertical of Maro Health, so looping in the providers. One way that we're doing that is setting ourselves up for a pathway toward EMR integration where we can send our data back to the clinic. The ultimate vision here is we believe that Maro's ecosystem model will create the largest data set of adolescent and pediatric mental and behavioral health data across both clinical and community context, which will equip us to create best-in-class predictive models to identify mental illness as close to onset as possible. In doing so, we're really shifting the market on its head. The market is currently reactive. It's spending $280 billion a year reacting to the mental health crisis. We think that we can make this a proactive setting through early mass screening and getting kids to care faster. We're very proud that KidsX has really accelerated our growth. After KidsX, we closed our pre-seed round led by AliCorp and Kpor Capital. We have gained significant traction both with schools and with health systems, and we have our first 2 health systems committed, one of which is on this slide, and I'm very proud to say that UVA Children's has given me permission to say that they are committing tomorrow as well, spearheaded by Jeff Vergalis, which has been amazing. We also won multiple industry awards, and sitting at the intersection of education and healthcare, that is critical to our mission. So we won the world's most innovative edtech startup, competing against almost 1,000 companies from 69 countries. And then we won an award from Oracle Cerner, naming us the #1 leading early stage pediatric innovation. I have an incredible team. Several members are sitting right back there, so please say hi to them. I want to highlight Tarek Chowdhury, who's our Chief Medical Officer and is the Chief Quality and Safety Officer of Kentucky Children's Hospital, and Brittany Reiser, who is a licensed marriage and family therapist and supported kids in a school setting before joining Morrow. My overall team is incredible at using their skill set as data scientists and technologists and clinicians and creatives to support kids in creating a healthy and safe environment. And then finally, if you are in health system leadership, if you are a seed stage investor, if you are in school leadership, or if you're a K-12 parent, there is a way for you to engage with Morrow. That is the beauty of the ecosystem model. So please scan this QR code. You will get my email address, my cell phone, and I will respond to you. We try to be highly communicative, and we're really grateful for your support. Thank you.
Well, thank you. So I'm Josh Seidenfeld from Cooley. I chair our digital health group globally, and we are very proud to be a partner with KidsX. The companies here, just what you're working on and what you're building is so profoundly valuable. I'm a parent of 2 young children myself, and so I really appreciate what you're all working on. One of these great companies I'm looking forward to introducing here, I will do that now, is Francesca Wadaki from NEN.
Hi, everyone. It's a pleasure to be here to present NEN to you today. I'm Francesca Watke, the founder and CEO of NEN. I've been a digital health venture capitalist, a chief digital officer. I'm a recovering pharma person. And we founded NEN a year and a half ago to bring pain management solutions to kids, their families, and healthcare providers. Our first indication out the gate is pain in pediatric oncology. It's a huge global unmet need. And of the 500,000 kids that are battling cancer globally, nearly all of them will experience pain. But what's worse is that these kids have negative pain memories as a result of the medical trauma that they receive during treatment. And these negative pain memories can be quite sticky, and they can persist through survivorship and into adulthood. 1 in 600 adults is a cancer survivor, and those adults tend to have chronic pain unless the psychological aspects of pain are appropriately managed. Kids communicate about their pain very differently than adults, and parents and providers have a very difficult time understanding how much pain the child is in. There are also, unfortunately, too few pediatric psychologists, and even fewer that are trained in pain management. But despite all these unmet needs, very few solutions exist for kids. Kids represent a quarter of our population, 100% of our future. Kids matter, and we're committed to kids. We're designing digital therapeutics to help kids manage their pain by leveraging play. We're gamifying cognitive behavioral therapy to help them manage their pain and also manage their anxiety and depression associated with that pain. We know CBT works. It's clinically validated. It's well established. We're just digitizing it at scale. By creating science-based gaming designed for kids with kids, we're helping them identify and modify some of these negative thought patterns and behavioral reactions to pain, which helps them reduce their pain symptoms, but also helps them manage their anxiety around the pain. And because it's a software solution, we can scale to a much greater number of kids than traditional in-person psychotherapy would allow. Kids have a really hard time differentiating mood from pain. To solve for that, in collaboration with our clinical team, we've created 3 virtual companions. Dolores, which means pain in Spanish, we're based in Barcelona, helps kids manage their pain with pain-related CBT. And then Sarah and Tony focus on the serotonergic receptor pathways, mental health. Sarah delivers anxiety-related CBT and Tony depression. We've selected a few areas that have the highest bang for their buck in terms of effectiveness with CBT, and those are the ones that we're most focused on. we've spoken to a lot of parents over the course of this journey, and one thing that's been overwhelmingly consistent is their sense of helplessness. There's not a lot that they can do when their child is in pain. So we've created a suite of services specifically for parents to help them help their kids get the best outcomes out of CBT. In terms of our business model, it evolves as we continue to generate more and more clinical evidence. We're really excited that we're going to market this January with a direct-to-parent solution that's fully GDPR, HIPAA, and ISO compliant. It'll be available in 8 languages for those families. The next is direct to hospitals. So we're collaborating with hospitals to gather and validate our clinical evidence and also potentially to serve as sites for a randomized controlled study. But what we're finding is that as these champions are generated, they're asking if they can white label NEN as part of their enterprise-wide pain management solution, which we're happy to do. And then finally, the goal is to be a prescribed and reimbursed digital therapeutic. We're starting with kids with cancer, as I mentioned, but the trauma-based CBT that we've deployed in our platform is applicable across all etiologies of pain. So our next step is to start validating in things like migraine, GI, IBS, IBD, aplastic anemia, sickle cell, congenital malformalities, and even post-op pain. And then we'll move to different age ranges. We're starting with 7 to 12-year-olds, and then we're hoping to move into the littles, the 2 to 6-year-olds, and we're in early stage discussions now with Sesame Street to co-create some of that content. Then we'll go to the teenagers because there's also a huge need there. This is why we're so excited to have worked with KidsX over this past year. They've opened up doors to a tremendous amount of hospitals that we're looking to work with now. We're going to be kicking off our clinical validation study this month, actually, hopefully, and we've been really, really pleased with the feedback and the validation from the stakeholders that are actually treating these kids. Very much aligned with our mission and vision, we're looking to democratize pain management at scale. So as soon as we've finished our clinical validation, we'll be kicking off the NEN Foundation. The NEN Foundation will be funded by grassroots organizations and NGOs to help us democratize and disseminate NEN at scale. We're in the middle of a fundraising round. We're looking to extend our seed round via our Safe Note. So if any of you are interested in investing, I'm happy to come speak to you after. And then we'll start pivoting into our next price round to fund the clinical validation studies. This is our amazing team. Shenya and I have been working together for 5 years, and she is an expert at commercializing digital health and digital therapeutics worldwide. Claudia leads our tech team. Grace, Drs. Cow and Rains are our clinical team. Grace is a pediatric pain psychologist at University of Texas Baylor, and Dr. Rains is a cognitive neuroscientist who used to run the gamification mental health labs at Optum Labs. And together, they translate the de novo content into a really fun, engaging platform for kids. Our advisors have been tremendous in garnering momentum for NEN and in opening a variety of different doors to us. Our clinical advisory board are experts in pediatric pain, and our business advisors are pediatric innovators, digital health venture capitalists, and social impact drivers. And very recently, a few months ago, we formed our board of directors. Robert is a partner at 7Wire, Steve is a partner at PHS, and Martin is founder and chairman of Health Excel. So thank you very much for your time and for the opportunity to present NEN to you, and come find me after and I'd be happy to share more. Thanks.
Our next focus area is care coordination. We were seeking solutions that promote coordination between specialists, between pediatric organizations, between providers and a patient's care network, and lastly for patients that are transitioning out of pediatric care. So without further ado, I'd like to introduce Ryan Kirkpatrick, co-founder of Leo.
Hi everyone, it's a pleasure to be here today. As Bianca mentioned, my name is Ryan Kirkpatrick and I'm a co-founder of Leo. At Leo, we're on a mission to provide physicians, parents, and asthma sufferers just like myself with a continuous understanding of pulmonary function through innovative design and our proprietary algorithms. Leo addresses the problems faced by the #1 chronic condition in children, pediatric asthma. Now, across the US, pediatric asthma has a huge cost burden, with over 50% of children considered uncontrolled. And sadly, the majority of these kids are from minority families, with their children 7 times more likely to visit the ER due to their condition. So what are the problems facing children with asthma? Well, it starts with the children themselves, who have great difficulty articulating their symptoms. Their parents, who are continuously worried about their child's breathing, must rely on methods of subjective assessment. And then finally, there's the physicians, who are left without actionable clinical data as soon as a patient steps outside their treatment facility. And all of this is because the current gold standard to assess lung function is spirometry. Now, spirometry is based on forced breathing, and it's a spot check only. It's very difficult to perform accurately, even with supervision, and it can only be performed when a child is relatively well. So the core problem here is that there's no easy-to-use digital tool for at-home monitoring of pulmonary function. Now let me introduce you to Leo, a solution 3 years in the making that has been designed specifically for children. Leo provides clinicians and parents with a continuous understanding of airway obstruction, all from the comfort of a user's home. The core of our innovation is the super thin, flexible, multi-sensor patch that is capable of passively collecting pulmonary, cardiac, and sleep health data. And that's all with the ultimate aim to predict and prevent asthma exacerbation. And in the flesh, the device just looks like this. It's very similar to a Band-Aid and is equally as flexible. But Leo is not just a patch. We've developed a complete end-to-end system that incorporates our patented rechargeable sensor, replaceable adhesives, and a mobile app. Our system also features an AWS infrastructure that enables our entire data flow to be automated. Now, some of you may have heard of acoustic-based wearables before. However, we know that our impedance-based technology is far superior. The reality is, wheeze is not a true biomarker, and it's almost impossible to quantify, whereas impedance is a validated technology currently used in clinical practice for non-invasive measurement of tidal volume and minute ventilation. Now, through the clinical trials at the Children's Hospital of Colorado, we've validated Leo against gold standard measurements and have achieved greater than 98% accuracy in estimating heart rate as well as respiration rate. Our key innovation is to estimate flow and volume waveforms from the collected chest impedance signal. And as you can see, when compared to the gold standard pneumography, our device has incredible accuracy. But our breakthrough feature lies in our algorithm that can distinguish between normal and abnormal breathing. Leo estimates tidal breathing flow and volume waveforms at night, and through our clinical trial data, we've developed a breathing variability index. This index can distinguish between stress breathing during acute exacerbation and normal breathing at recovery. Now, although my focus today has been on pediatric asthma, Leo's specialty is in continuous pulmonary function monitoring. So there's the potential to go well beyond and explore or take advantage of Leo's multi-sensor capabilities and explore many different care settings as well as use cases. With the key biomarkers Leo can provide, there's the opportunity to utilize the Leo system for telemedicine, remote patient monitoring, and even diagnostics. And through KidsX, we've partnered with Schneider Children's and Children's Hospital Omaha to explore just some of those possibilities. Schneider Children's is looking to utilize Leo for sleep apnea diagnosis, as well as an at-home monitoring tool for their asthmatic patients, whilst Children Omaha believe Leo will be a valuable tool within their NICU. Now, in addition to all the potential benefit Leo provides, we have the unique advantage of being funded and supported by the talent and resources within ResMed. ResMed is the world leader in cloud-connected medical devices, and with over 15 billion nights of medical data, we pioneer innovative digital health solutions that help people live healthier, happier lives. But it's not just adults that we look to serve at ResMed. So whether you're a physician, farmer, or even a parent, if it's your job to take care of a child with a respiratory condition, we would love to speak with you. Thank you all for your time today. If you have any questions, want to see the device in person, or even just want to have a chat, I'll be available at the ResMed booth following the completion of this session. Thank you.
We next welcome Haley Coombe, VP of Product and Client Advancement at Doctivity Health.
Hi, everybody. So thank you so much for joining us today. It's a true pleasure. My name is Haley Coombe, and I am the Vice President of Client and Product Advancement for Doctivity Health, and I look forward to taking the next few minutes to really walking you through what our application is and what our application does. If I can figure out the slide. There we go. So our story really begins when our cohort team was working inside of Geisinger Health System in Pennsylvania under the tenure of Dr. Glenn Steele. At the time, our team was really focused on provider productivity and ensuring that new providers coming into the system were ramping up and hitting their productivity goals. After a few years, Doctivity's president and COO left Geisinger. I joined her, and we did boots on the ground consulting for several years with healthcare organizations, really focusing on thank you. I have a little baby voice there. Really focusing on provider productivity, physician relations, and helping healthcare organizations drive new revenue to their bottom line. It was after that time at Geisinger, after that time consulting, that we really have centered on this market need. It's not a secret that healthcare organizations need to reduce the losses associated with their providers, and there's really a lack of actionable insights into physician performance, referral management, and not a lot of support to help that development and implementation of strategies to impact and improve financial performance in healthcare organizations. And that is where Doctivity comes in. We are a SaaS application that addresses that market need by helping healthcare organizations drive new revenue through key solution areas. So up here on the screen, our big buckets really are network management, referral targeting, provider ramp up, physician liaison strategy, and market expansion. So helping our clients understand who are referring providers in their market, where are they sending their business, where should they outreach different growth strategies, new buildings, do they need to recruit new providers, and really bringing that all together. So I'm sure, there's some of you out there that are sitting in the audience thinking, okay, Haley, I've heard that before. This is something I've heard over and over again. But I'm here to tell you that Doctivity is truly different because we bring multiple internal and external data sources into one single, source of truth, one single solution. We allow users access to immediate analytics to really quickly pivot strategies to drive that top line revenue growth. And we focus not only in the adult space, but as well as pediatrics, which is how we were connected through KidsX. So we specifically within our data pull out those kiddos 0 to 18 and show really specific views around those referral patterns and trends with kids. So we have 3 core data buckets. So we work with our clients' own internal data. We can work with any EMR system. We don't have any PHI in our system, which makes it really easy for us to implement. So we do work with our clients' internal data. We also have all payer claims data, which has been a big differentiator. So both Medicare, Medicaid, those commercial payers, and we refresh that data every 90 days in our system. And then the third bucket has also been a big differentiator for us in that we pull together that qualitative data piece, so really focusing in with physician relations teams as they document market intelligence, what they've been doing out on the road, and it also helps to measure that ROI that I'll talk about here in a little bit. So this is just a little teaser. I couldn't bring it up and do an actual product demonstration, but we do have a kiosk here. If anyone's interested, stop on by our booth. But looking at the screenshots, we allow our users to create customized markets to look at the data. So we have this data nationally. They can slice and dice that data. You can filter that by different diagnoses, different procedures. We cover 5 care settings, and then you can see that unique patient volume by organization, by provider. And one of our big use cases for our tool is really looking at those referral relationships. So you can look up any provider in the United States with an active NPI and see those referral patterns, again, by different diagnoses and different procedures. And then I mentioned we work with our clients' own internal data. So we have an example of a dashboard there of how you can configure that data to really focus on the priorities of your organization. So the good news with this is you don't have to take my word for it. You can take the word of our clients and those results that we've been generating with them. So I mentioned that our work actually started with Geisinger Health System when we were working inside of there. They are a current client, and we have several use cases with them. One of them is that we've generated 100 new patient referrals that have resulted in a little over $2 million, and we did that by focusing on a priority market and identifying a significant amount of leakage from internal primary care providers. We've also helped improve surgical case mix, so working with a new surgical subspecialist that was joining the system and increasing that new patient volume, resulting in 20 plus surgical cases by really, again, focusing on referral targeting. And then we also work with Valley Health out of Winchester, Virginia. And there we were working with a cohort of about 15 mission critical physicians and working with those key performance indicators, so looking at RVUs, some of those other metrics, and they use the Doctivity data to put together performance improvement plans, and we're able to increase the productivity of those physicians. So, as you can see by our current partners, we can work with any type, any size of healthcare organization. So from those larger academic medical centers to those community hospitals to children's hospitals, we are in the process of signing with an independent specialty practice. So we're here to help. So whether you're big, you're small, we are here to help you. Through our fantastic partnership with the KidsX team, we are currently piloting programs with Gillette Children's as well as Marybridge Children's, and they're really interested and loving our product due to the fact of how we separate out those pediatric patients within the claims data. So, I mentioned our team came from Geisinger Health System. With Doctivity, you just don't get a SaaS application. You get the full expertise and backing of our whole team. We are truly healthcare people. You can see we have a fantastic board of directors, an advisory board. It's full of former healthcare CEOs, experts over physician practices, C-suite executives, and we're with you along the way. So we just don't implement with our clients, we stay with them throughout the process and ensuring that we are driving that revenue like we say we do. So thank you all for the time today. I would love to continue this conversation, answer any questions. Like I said, we have a kiosk here that's in the 3,000 area on the floor. Maybe give a little of a high-level product demonstration or schedule something that's a little bit more thorough, but would love to show you and continue those conversations and answer those questions. So thank you very much.
Our final focus area today is patient experience. Solutions in this area are intended to focus on a pediatric organization's digital front door, translation or education services, communication, or any other aspects of pediatric patient experience. We now welcome Aurel Swenson, VP of Partnerships for Florence.
Thanks, Bianca. All right, let's see if I got this thing right. So, hi all, my name is Aurel Swenson. I'm the VP of Partnerships here at Florence, also an ER doctor by training. I'm gonna do you a favor. I'm gonna go through an entire presentation today without using the words machine learning or AI outside of this, a health miracle. So, like all the other digital, well, hold on, maybe. There we go. Like all the other digital health companies here, we are here set out to effectively empower, create capacity to care, I should say, rephrase. What do I mean by creating capacity to care? We use the power of our platform to reduce administrative burdens for nurses, clinicians, healthcare providers in general, unlocking their time to allow them to deliver the care that they set out to do and the jobs that they set out to do when they signed up for this. Like any digital health company, the most important part of our success is the team behind us. So to that end, I think we cover the three most important parts of a successful digital health company. We understand healthcare quite well, unsurprisingly. We also understand digital technologies, and perhaps most importantly and often overlooked is an understanding of the consumer experience. How to build things and products really that patients, providers, nurses would actually enjoy using. We're backed by leading institutional investors, including Thrive Capital, Salesforce Ventures, and Google Ventures, to the tune of a $20 million seed round we raised this past November. More importantly, however, we're also trusted by a number of large healthcare systems. So we have 40 healthcare system partners, 4.6 million patients having come through our platform, and 3,500 clinicians having utilized this. We average a 89-second asynchronous visit time, allowing for marked efficiencies in care. Taken overall, our main mission is to empower for the patient a virtual first care platform. What we mean by that is whether you begin your care in the emergency department, an urgent care setting, or online, at home, or from your smartphone, at all times you interact through a virtual first environment. The reason behind that, of course, is that this is what consumers and patients have come to expect today through their interactions with all other industries at this point. So a patient might begin a fully asynchronous care visit, completed online at home, transition to the ER or urgent care if they need to be stepped up, or show up in the emergency department and be transitioned into an asynchronous care platform. At all times, again, keeping that virtual experience top of mind. For the providers and nurses, we offer agile care delivery through the use of our platform. And what does that really mean? It means that this platform and the products that we've built flex up and down depending on the needs and use case of the patient. So we might complete a visit completely asynchronously, or the provider might choose to use it as a note writer service, or simply alleviate some of the burden behind their telehealth visit, cutting their visit time in half on average from 15 down to 7 minutes thanks to the pre-populated SOAP note and the accompanying evidence-based medical decision guidelines that they have. All of our products are offered and can be stood up in 45 to 60 days as a white label deployment to allow for, if you're interested, meeting the demands of flu season right around the corner. Feel free to talk to us afterwards. Beyond that, we also offer very deep integrations, allowing you to make use of single sign-on and other EMR considerations, writing back directly into the EMR and the appropriate discrete fields if you want to go to that level of depth of integration. Taken as a whole, the platform is meant to enable a fully hybridized care environment. As I mentioned, whether you start your care journey online or in person and transition from an asynchronous visit to a telehealth or in-person visit, or from an in-person visit because you're a low acuity patient into an online setting, we provide that hybridized and virtual first experience that both patients and providers have come to expect and will demand more of as we move into the future. So what does this look like overall from the patient's perspective and the provider's perspective? So as a patient, if you're online thinking you might have a UTI, pink eye, or a number of other primary care or low acuity conditions, you begin your visit asynchronously through the partner healthcare system's website, going through all the questionnaires, sending this information off to the physician from the comfort of your home, and getting your answers back in as little as 89 seconds, at least from the physician turnaround time. Or you might show up in the emergency department, and we drive the engagement with your visit from day one, or from moment one, in so much as patients begin answering the questions about their medical history, surgical history, as bidirectionally integrated in the EMR, writing back and pulling forward previous information, all of which is meant to keep them engaged, but also ensure accuracy and shift some of the burden from the providers to the patients. In so much as that goes, the asynchronous care platform delivers a fully written out SOAP note for healthcare providers to utilize, accompanied by best-in-class evidence-based medicine protocols that pre-populate the most likely diagnoses, as well as the most useful prescriptions that are to go along with it. So too for nurses who make use of the ER Guide platform. As patients enter their intake questionnaires and it's written back into the EMR, they see an average of a 6-minute savings times 6 minutes time saving per patient encounter when using the ER Guide. Statistically, things speak for themselves. So again, about 4.5 million patients now, averaging an 89-second asynchronous visit time. Our 60-plus protocols lead over 400 unique diagnoses. On top of upfront revenue generation, we are fully aware of the fact that the increasingly competitive environment makes us aware of the need to attach patients to your healthcare system and drive that brand loyalty, and we do so quite effectively. Patients making use of asynchronous care protocols sponsored by their healthcare systems are 276% more likely to become lifelong patients and drive substantial first-year and further downstream revenue. And patients love what we do as well. In the App Store and the Google Play Store, we have 4.9 out of 5-star reviews, over thousands of reviews. An NPS score of 64 puts us on par with Disney in terms of patient satisfaction. Of course, all this, as I alluded to, would be very meaningless if we didn't ensure high-quality care was delivered. So we have our own internal clinical quality advisory council, staffed by physicians and nurses, and perhaps most importantly, all of our partner healthcare systems are allowed to sit in on this. There's CMOs, DNPs, and others to ensure that any updates to the protocols meet, again, top-of-line evidence-based guidelines and are also scalable across healthcare systems and different practices. And with that said, obviously, a shout out to KidsX and the value prop they've offered to us. As a result of KidsX, we are actively engaged with multiple different pediatric hospitals. I can't, unfortunately, disclose the names of those just yet. And perhaps just as importantly, much of the mentorship that we received over the course of the program has been substantial in revising sort of our product roadmap and giving us a lot of insights into the unique aspects of care for a pediatric hospital. For those of you that want to talk to us, obviously I'm around afterwards. And then Matt, where's our booth? 52, 56, right about that way. So happy to meet up with you there as well. All right, thank you all for your time. I appreciate it.
All right, thank you, Aurel, and that is the conclusion of our company presentations. Hi, everyone. I am Deepa Shah, and I have the privilege and honor of leading our KidsX team. We want to give a big, big thank you for our companies that were joining us here and showcasing all the work that they did in pediatrics as well as through our accelerator. Big shout out to 2 companies that unfortunately couldn't join us today, Violet and Care Advisors. They're doing amazing work in health equity, so please feel free to connect with them or any of the companies you saw today using the QR code you see on the screen. My team and I would also like to give a big thank you to our KidsX sponsors and partners, City of Glendale, Redesign Health, Cooley LLP, Delta, and Extra Life. Without their support, we wouldn't be able to execute our various innovation programs and accelerators. And lastly, if you'd like to join the KidsX network, either as a startup, advisor, investor, partner, please connect with me or anyone on our team. We welcome the conversation. Thank you so much for joining us today and enjoy the rest of your time at the conference.